morning and welcome everyone. My name is Maya Soma and I'm a research assistant at the CPC Learning Network. We are delighted that you have joined us today to learn more about the increasing people's access to legal identity documents in Indonesia. This is the second webinar of webinar series that the CPC will be hosting this year on the way that the child protection system should seek to reach the most vulnerable children. We are very happy to have Santi Kusunigurum as the presenter of today's webinar. Santi is the co-director of Push Kappa, one of the CPC affiliate institutions at the University of Indonesia. Push Kappa works on research, policy advocacy, and program implementation on child well-being issues in partnership with the government, development partners, and civil society organizations. Previously, Santi spent more than 6 years managing policy and justice for children's program in UNICEF Indonesia, and 6 years before that as an assistant lecturer and presenter at the University of Indonesia's Department of Criminology. Now, Santi is also a Dr. PH student at the Columbia University. I'm sure that you're all excited to help me join and welcoming Santi. A few note about this webinar. It will be recorded and uploaded on the CPC Learning Network YouTube page in case you're unable to attend the entire webinar. Also, if you have any question for the presenter, you should be seeing a little chat box and you are highly encouraged to type in the question and send it over anytime during the webinar. We will then consult the date and hand them over to Santi, which she will be answering towards the end. So thanks very much, and over to you, Santi.
Thank you, Maya. Good morning, good afternoon, and good evening for everybody, and thank you for joining us today. I'm going to turn over to the presentation slides now, so I hope all of you can see what I'm seeing on my screen as well. So as Maya had introduced us to today's topic, we will be covering these issues about increasing people's access to legal identity documents in Indonesia. Particularly, this is a project that Puskapa is currently implementing in collaboration with the Australia-Indonesia Partnership for Justice, or AIPJ. That will be one of the acronyms you'll be hearing a lot. And also, one of our main CSO partner is PECA. PECA is an NGO working on grassroots level with a female head of households, and they have representative in about 18 provinces out of 34 provinces in Indonesia. Okay, so we'll begin by a little introduction on why we thought about implementing this project in the first place. So we see legal identity as an enabler to, of course, it's the basic human right, and it's a basic child right to have identity, to have their birth registered, and to have a birth certificate. But it also serves two main purposes. One is that legal identity documents can directly facilitate people to access health, education, social services, legal protection services, as well as financial services. Like, for example, you cannot apply for a bank account if you cannot show that you have a birth certificate and an ID card, of course. The other purpose that legal identity we see as important is that legal identity is actually the end product of a working and functioning population administration data system. And by having a civil registration and population data that is accountable and accurate, then the data can inform a proper planning and policy in development sectors. So it would guarantee better allocation of resources, more effective services, as well as more effective advocacy for people and civil society organizations to work on. Okay, so what I will be sharing with you today is our baseline study, as well as the continuation of, like, after the baseline, because we are doing program implementation and we are still collecting data from our program implementation as well. But mainly we are looking at a birth certificate, marriage certificate, and divorce certificate. And I will talk more into why we choose these three main legal identity documents to start our program. So we looked at ownership, impacts, and barriers from accessing those type of legal identity documents. And we focus our study in looking at conditions around women living in poverty, vulnerable children, and people with disability. Okay, so in some countries like Indonesia, a legal identity document of parental marital status is a requirement for getting a birth certificate for a child with both the father's and the mother's name. So in Indonesia, you can actually register your child without a parental marital marriage certificate, but it can only be registered under a mother's name. So you can be sort of quote unquote a child of a mother's, and the state would not recognize your father in your birth certificate if your parents cannot prove their marriage certificate. But when we go into community and we ask what do they feel if their child is registered only under the mother's name, 64% of parents find it negative. So they find it sort of like a stigma if their child is being registered only under the mother's name. And even broader than that, having a birth certificate with both parents' name is the right of a child. Every child's right to know their parents, their father and their mother, and it provides them with greater legal protection in the future for inheritance, custody disputes, and all of the related legal matters. Okay, so we did our baseline back in 2013, and we collect a number of sources of data. So our partner CS-OPK collect a community-based survey done in 17 provinces, and they interviewed around 250,000 households. We did a cross-sectional household-based survey in 3 provinces, so West Java, West Nusa Tenggara, and East Nusa Tenggara. We did some analysis of the available national socioeconomic survey data. We also collect admin data from service providers such as courts, civil registrars, and religious affairs office in 20 districts, and AIPJ is working in these 20 districts. And we did in-depth interview with a bunch of stakeholders in 5 provinces, which are the area of AIPJ work as well. Okay, so the situation in Indonesia, so based on the 2012 survey data, we found that over 24 million Indonesian children do not have a birth certificate. And the way that the survey is being managed is that they ask if they claim that they have a birth certificate and they can show it, but they also have this option of they claim they have a birth certificate, but they cannot show it during the survey. And if we include those who claim that they have but could not show the birth certificate, we can come up to an almost 40 million children without a birth certificate in Indonesia alone. And through our cross-sectional survey, we found that 70% out of those respondents who claimed that they have but were unable to show a certificate were actually never had the certificate in the first place. So we can assume that most of them who claim that they have but cannot show the certificate actually do not have the certificate. So as you can see, nationally we have 52, like 29% of children do not have a birth certificate, and 19% of children claim that they have but cannot show the document. But if you look at it specifically on a couple of provinces here, East Nusa Tenggara and North Sumatra, you can see that those who are without a birth certificate are more than half of the population. So the disparity of situation is also differ across provinces. If you look deeper into their socioeconomic status, you can find that the largest proportion of children without a birth certificate is in the poorest families, and for those under 1-year-olds. So nationally, 47 children are not registered, but it also sort of correlates with the fact that 50% of marriages are not registered nationally. But again, if you look deeper into the poorest 30% of the population, then marriages who are not being registered goes up to 55%. And it correlates with the increased number of children who do not have a birth certificate, up to 75%. And this situation is doubled in rural areas than that in urban areas. We also found that this deprivation of legal identity is passed across generations, because children from parents who do not have a birth certificate are 3 times more likely to not have a birth certificate, and children from grandparents who do not have a birth certificate are 13 times less likely to have a birth certificate. We tried to collect better information on children with disability, but we could not find enough sample size. But at least from the one that we could find, we found that children from parents who have visible disability are 5 times less likely to have a birth certificate compared to other children. And now we looked at the services. So this is the data we collect from our program implementation for the past 1.5 years across the 20 districts. And you can see, even if we are optimistically count every single birth certificate that every child registration office produced in 3-year time, we still have a lot of gaps, even by comparing them with an estimate number of children who do not have a birth certificate in 1-year time only. So this is a big issue. Of course, quality of data is different across provinces and across district. Every civil registration office collect a different type of birth certificate data. Some of them do not have a good recording of data, so it varies in terms of quality, but at least from what we can collect, this is what the data is telling us. If you looked at more specifically on the under 1-year-old population, and you compare that with a live birth number, you can also find this gap. So the coverage is only around 35% to 37%. And if you also look at the data, the national data from year to year, you can find that there's not much significant improvement made in the past 7 years for under 1 ownership of birth certificate. And the situation is sort of similar if you look at under 5 as well. Okay, so this is just to break them down into the provinces that we're working in. And you can see that, for example, we try to also understand better why situation is so much more, it looks like more optimistic in North Sumatra, for example, the second one from in the row, is that because they have less district who applied late registration fines or late registration extra costs. Okay, and now we also look at the impact. We didn't find much difference of ownership of birth certificate between boys and girls, but we can also see that girls suffer greater impact. So if you look at deeply in the poorest 30% household, we found there are 25% of girls who were married before they turned 18, and almost none of them had a birth certificate. 13% of them were married before turning 16, and 16 is the minimum legal age for marriage for girls in Indonesia. And almost none of them had a birth certificate as well. And if you round up the data, none of them complete 12 years of education. This is not to say that having a birth certificate would immediately prevent you from being a victim of early marriage, but at least it indicates that those are the same vulnerable population we're talking about, and they share the similar deprivation of legal identity documents, and none of them were able to complete 12 years of education. We also looked at likelihood or chance of children who have a birth certificate and those who do not have a birth certificate with their furthering their education. And we found that having a birth certificate would increase a child's likelihood to continue to a junior secondary school by 58% and to senior secondary school by 89%. Again, poverty also play a big role because previously we saw that most of the poor children do not have a birth certificate, and then we see this correlation with education. But again, my point here is that it shows that these vulnerable populations share similar vulnerability and similar deprivation of certain rights. We also looked at that mothers and children who have legal identity documents, both birth certificate and marriage certificate, have better access to health services. So we can it shows us a very strong evidence that this is all about access. So if you see poverty, access to legal identity documents, as well as access to health services, you can see this parallel sort of pathway of accessing these basic services for women and children. And we also looked at if women head of household can access social assistance if they have a legal identity document, and our data shows us that women with legal identity documents are accessing health insurance and subsidized rice in a couple of provinces in a higher rate than those who do not have a legal identity document. Again, this study, of course, had limitations. We did not look at a non-household setting population. So of course we could not tell much information about children on the street or people on the move or people living in border areas. But we are planning to collect some of these type of data in our second round of data collection this year. We are also planning to collect more data to look at ID cards, just to expand on the type of legal identity documents, as well as death certificate, just to get a sense of that a very important part of vital events in the population as well. Okay, so the barriers. From the survey, we found that largely a majority of the households we interviewed found that getting a legal identity document is too expensive. It's so costly, and the fees also apply to late registration fines. The services is also too far, so distance to the nearest civil registration office is also a problem, and it goes for both geographic, the time they have to spend, and which means it's the opportunity cost they have to pay for living their livelihood for a day, for example, and also mobility issues. Most of them also found that they have lack of understanding of the importance of legal identity document, but they also found that the process is too complicated for them to handle. So if you have an unregistered marriage, and by that you then do not have a marriage certificate, but you want your child to have a certificate with both the father's and the mother's name on it, you have to go through at least 3 different government offices to get your child a birth certificate with both the father's and the mother's name. One, you have to go to court to get your marriage legalized. And then second, you have to bring the court decision to Religious Affairs Office to get your marriage certificate. And this is for Muslim population. And third, you have to bring all of this document into Civil Registration Office, who will then register your child's birth and produce the birth certificate. Very, very complicated. So we see this dynamic between supply side barriers and demand side barriers for poor access to legal identity. And if you can see on the left-hand side, we talk a lot about the supply side barriers, from poor resources, lack of leadership, very, very unfortunate disincentives policy like fees, fines, and complex requirements. And also there's a disconnect between civil registration, statistic body, and also health sector. On the right-hand side, you can see that it's all about what we talked about before. It's distance, it's the cost, it's the lack of understanding, and it's also that the process is much, much too complicated. So how do we go about it? So as a program, what we've been implementing for about 1.5 years now is to really tackle on those specific barriers. So we try to eliminate the cost by, of course, doing a lot of policy advocacy for districts and national government to remove the fees and the fines regulation. But we also work in bringing the services closer to people at the village level so they can cut the cost of having to travel to register your vital events. So we are doing that by collaborating with these 3 different entities and trying to pilot a mobile and integrated service model at the village level. We're also working with civil society organizations who facilitate mobilization of demand. They collect the data. They also help support families to collect the requirements, and all of those very, very complicated, complex process to help families address these barriers. And we're also working in providing very, very friendly packages of information, both targeting the supply side as well as the demand side. And we always try to include an inclusive approach so that it will reach also population with disabilities and special needs. So yeah, so this is what we are doing practically as a framework. So we're working by, of course, we start with data and research. So we have evidence-based information that will then inform our policy and regulations advocacy. It will inform the way we design our integrated and mobile services model, our CSO partnership, as well as our information approach. So this is just to give you an idea of what we meant by integrated and mobile services. So ideally, on the same day, in the same location, at the village level, people would be able to access court, so their cases will be heard by a traveling judge. So they do not need to go and travel to the court building, but it's the court who comes to them. So their cases of marriage legalization will be heard, the decision will be produced at the same day, and immediately after that, then you can go to the next desk where a religious affair officer can then produce your marriage certificate, and then to the next desk where civil registration office would immediately produce the birth certificate for your children. It sounds quite straightforward and simple, but in reality, it's a very, very complex process, especially before the day of the service, because it's where you have to collect all the requirements, get your documents ready, get your witnesses for the court. So everything has to be prepared before the actual day of service. And it's probably also worth to mention that this is what we've developed for Muslim population, because the process would look slightly different for non-Muslim population. For Christian, for Catholic people, we have this very, very complicated different mechanism for each religion. And for non-Muslim, it would involve churches, it would involve also the religious leaders and others. Okay, so we are envisioning that we know and we are aware that this is not enough. In fact, from our pilot services, we discovered that the most optimum and the most efficient way to deliver services is that in one day you can only serve around 50 couples, and if they have 3 children, then it means around 150 children. So that's not a lot, and we know that we need broader strategy to actually address a gigantic issue. So we're envisioning that in the next year, and hopefully it could be also made long term, that we would target this, at least we start with birth registration, and we would target at specific points of, let's say, specific points of pathway. So at birth, you would, on the left-hand side, be strengthening collaboration between birth centers and midwives and civil registration office. But if at birth the parents do not have a marriage certificate, then they will be referred to the right-hand side, which is the integrated and mobile services that we just talked about. So we would have this both sort of anticipation in each of these points in a pathway. So at birth would be the birth centers. Before 1-year-old, then the immunization centers, because the last immunization a child will receive is when they reach 9 months old. So we're looking into that collaboration as well. And also before 5-year-olds, which will be hopefully be able to work together with ECD centers and civil registration office, be able to partner with ECD centers at community level. So we're, and of course, if we still missed a number of children, then we would be targeting them before they reach 18 in special situations. But hopefully we can like target most of the population at birth, and then it would help the overall problems. So this is our strategy I've talked about earlier, and that's it. Thank you very much for listening, and I've looked forward to responding to your questions. Back to you, Maya.
Okay, thank you, Santi, for a wonderful presentation. I think it was very interesting and kind of fascinating to know how legal identification actually has a huge impact on people's vulnerability, poverty, health, and pretty much all the well-beings in general. So the very first question actually comes from me, and that would be, I was wondering, what would happen to orphans or children, who are unable to identify mother and or father, and if there's any other alternatives for those children, if can the caregivers or adopted parents can take over the whole marriage certification aspect, and if there's any kind of special treatment to these kind of children. And let me go with just one more question as well. And this comes from Stuart Keen. And he's asking, please explain which services require children to present birth certificate, example, schools, clinics, and social welfare.
Mhm.
Okay.
Okay. Thank you for the questions, Maya. The first question from you, the answer would be yes. So we have this in our administration law. We have this special group we call the children without parental care. So it's probably orphans, as you mentioned, and it like ideally, in theory, there should be a very rigorous tracking and tracing process before a child can be named as parentless, quote unquote. And if they cannot find the mothers and the fathers, or either the mother or the father, then a special certificate will be issued for them. And the agency who plays the main role in this is Social Affairs Office. So Social Affairs Office has to work together with Civil Registration Office on this matter. But I'm just like to point out that the fact that we need to be very careful in issuing like orphan certificate, because as you probably know that almost 90% of children living in institution or care institutions actually still have at least one parent alive. So they're there because they need to access school. And so this is also a situation in reality, excuse me, that people have to be aware before they like issue a very special certificate for them. The second question is, it's a very good question. Actually, I forgot to mention this. So services where children need to produce birth certificate is, yes, to apply for school, to register for school, starting from ECD throughout primary, junior secondary, and senior secondary. So that is in the law, that they have to have a birth certificate before they can register to school. Fortunately, schools still apply different, so some of them are still pretty lenient with this regulation because we understand there's too many children without a birth certificate. So they would allow a child to register by showing other types of document, like for example, parents' ID card, or like a letter from the village head. What I would like to point out here is that we are also encouraging schools to not deny a child to be able to register to school, even if they don't have a birth certificate. But I think the point of opportunities here is actually school can play a role where they can identify the demand. They can identify children without a birth certificate, and then they can link them up to the necessary services that would enable them to actually get one. Because later in life, they would need this sort of documents. Like also in primary school, they have to produce birth certificate before they can apply for the national exam, for example. We also had qualitative data that tells us that they need to produce birth certificate if they are entering into like district level competition or province level competition, and even more for like national level competition. They also need to produce birth certificate if they want to like get a passport, if they're applying for health insurance, and other sort of services. Yeah, I hope that pretty much covers your question.
Okay, thank you. And we also have another question, also
Mm-hmm.
for Stuart. Thanks so
Mm-hmm.
much, Stuart. So he's saying, have you used mobile technology to help to decentralize the process? And if
Mm-hmm.
you have, please explain how it works.
Okay. Um, I I have heard of like pilot projects that try to also apply mobile technology based initiatives. I have to get back to you on that information just to see what like which organization actually implemented this. But to us, we uh, we did not want to jump into a technology quick fix sort of approach before we can actually tackle the root causes. And we found that the root causes is actually the all this very complex and complicated procedures and requirements, and especially this requiring of a marriage certificate before you can actually have a birth certificate with both the father's and the mother's name on it. So we see that this is a more significant issues rather than uh, to have the technology approach. But it's not. Um, I think in the future we should uh, consider using technology approach into simplifying all these procedures when we already have this simplified requirements uh, and working system.
Wonderful. I also have one quick question. I was wondering if there is any global level effort to kind of exchange the information on what
Hmm.
has been successful in the certain
Mhm.
country, the learning lessons, kind of like an interagency group for this
Mhm.
birth registration process. And we also have a question from Nurul, and the question is how to tackle government's reluctancy to simplify the procedure to achieve universal birth registration.
Hmm. I would like to have the answer to that question. Okay, so on the global initiatives, I think UNICEF is has been leading on especially birth registration issues. So you can actually look up. There are plenty of publications produced by UNICEF uh, in sharing experiences from countries, regions, and also globally. And I would say that WHO is also very active, and especially on death registration, although it's not a part of our topics today, but WHO is also very, very active. In terms of recent global initiatives, I should mention that in the past year, there has been increased attention to this matter. One is the inclusion of this legal identity as one of the proposed targets for Sustainable Development Goals post 2015. And after this, I would be happy just to give you, share you the link to that document. It's the open working group document on the proposed SDGs. Secondly, in the region, there's this Asia Pacific Civil Registration and Vital Statistic Action Plan for 2014 2024. So it's like it's a decade of improving civil registration and vital statistics. And if you looked up at their website, they cover overall 6 vital events, which includes birth, death, causes of death, adoption, marriage, and divorce. Um, there's also been an initiative uh, initiated by the World Bank. One is called the ID4D, so it's the ID for development, and they're focusing on provision of national ID document, identity document for people to access services. And the other one is what they call the scale up investment for CRBS. And this one has a more health approach because it looks at those 6 vital events that I just also mentioned. Uh, on the question about how do we tackle government reluctancy, uh, I'm afraid I don't have a straight answer to that because it's a part of what we're struggling and what we're dealing and what we are trying to address in a long term. But at least our position is that we believe that first is evidence. If you show the evidence not only on the situation and like how poor the situation is, but also about how how much benefit you can gain from a certain situation being improved, then you can include that in your policy advocacy. And I'm sure, like we believe that that would add to the cause. Secondly, is that you have to help them. You have to provide incentives. It can be I mean, like it's like an incentive system for both the supply side and the demand side. Uh, on how to like actually if you know that there's a benefit of improving such a situation, then you have to support them, you have to facilitate them and trying to figure out how to get there. So it's what I call the like developing an incentive system for both the supply side and the demand side. mm, and what else? I think, yeah, just like tirelessly do all this in repeat. I think you show evidence that this is that there's a benefit. You show that people actually better off with the improvement of such a situation, and you just go back to that cycle over and over again.
Okay, thank you, Santi. Unfortunately, we are out of time now. But as you can see at the very last slide, there is Santi's contact address, and also we have this request asking if you can also share the website of Push Kappa and the information that you've shared today. So I think we can add on before we upload the slides to share.
Mhm.
Yes, so once again, this webinar was recorded and will be available on the YouTube page of the CPC Learning Network. Um, so, with no further ado, big thank you to Santi, and I hope everyone enjoyed as much as I did. Thanks for participating, everyone, and have a great rest of the day, evening, and afternoon. Thank you.
Thank you very much.